Hi, my name is Brad Siff. I'm the founder and president of BioWave. I'd like to introduce you to our new webinar this month. The title is called PI Made Easy. You're going to learn about the process to successfully integrate personal injury patients into your practice and use BioWavePENS as a key pain management tool to provide superior clinical outcomes and economic returns. Michael Coates, who is our guest host this month, is a California licensed attorney that has established himself as a national authority on medical lien law, lien recovery, and negotiations. He has helped hundreds of providers recover millions of dollars from law firms. He will discuss the methods, strategies, tactics, and tools to create a high profit practice treating personal injury patients. So with that, I would like to introduce you to Michael Coates.
Thanks, Brad. And I just am so appreciative of you, BioWave, and really all the people that will be attending here, because this really is about them. Not only what your wonderful product, but certainly the knowledge I want to impart with them today, because it really is about success. And success in today's medical environment is not easy as healthcare reimbursements go, so far down. They need something else. And that's what we're going to give it to them today. All right, everybody. So today what we're going to talk about is the personal injury business advantage. And that's really what you get having a personal injury segment. And by the way, just so you know, as a precursor in this, and while I focus on the PI side, I do not believe that any practice should be entirely personal injury. I think the wonderful thing about medical offices is the synergy between practice segments. I do think that most all medical practices should have a personal injury segment. The size of it is up to you. So we're going to talk about and give you a little bit of a road trip, right? What Personal Injury Made Easy, my company, is kind of a roadmap to successfully navigate what I call the high profit highway. Now, when you have someone speak to you, I think it's good to know a little bit about them. And first, I think what they believe. So let me tell you 3 things that I believe going into this. I believe that you deserve greater success. As a business person, you're great at healing, and I want to see you also succeed incredibly as a business owner. So I believe you also deserve greater rewards, not just survive, but to thrive. And the last thing, which I think is really lacking a lot, is I believe that you need more and greater guidance. So I'm going to give you some of that here. We have a short amount of time, but I hope that you will come away from this better for having been here. So I'll tell you a little bit more about me. I'm your coach, educator, and guide for the day. I'm an attorney by background. I'm a business owner of Personal Injury Made Easy, and I speak around the country at conferences, on webinars, kind of on a lot of the different states in the country, and for all the different medical specialties, being at the pain conferences in Florida or the chiropractic conferences around the country. And it really is about helping you be a better business person. And where I've gotten all the things that I've learned from is being in the trenches in PI for well over a decade, where I've helped champion hundreds of providers with hundreds of law firms recover millions of dollars. And I think when you look at anything, it's good to kind of take a broader picture view. I think when I travel around the world, I love when I get in the plane, and I take up off the ground and you start to see the topography, as you start to land again and how it changes as you get lower and lower. So that's what we're going to do first about PI. I'm also a big movie buff. So if you don't mind, give you a little bit of Clint Eastwood, a little bit of the good, the bad, and the ugly. Now, when someone says, do you want the bad news or the good news first? So when someone says, you want the good news or the bad news, I'm one of those people that really likes the bad news first. And so let me start off with the bad and the ugly of personal injury. I'm a big believer that we all should have truth and that helps us make better business decisions. So I want to give that to you here. So there are things that are bad and ugly about personal injury. I mean, no doubt about it. You got to wait to be paid, sometimes years. There's extra overhead, and you got aging accounts receivables. Then you've got attorneys that like to get their nose in your lane and direct medical care at times, sometimes far too often. And of course, what you've always heard about You can get a lot of very steep bill reductions, and not all PI cases are winners. Some of them are losers. You also in PI, you got third-party scrutiny of your bills. So you're going to have non-medical providers looking at them. You've got attorneys for the defense side. You've got adjusters, judges, juries, and of course, even your own patient. And that's different than what you usually have in when you're treating patients. And then with the advent of some new laws, you might have other people that might look at it, even from CMS, and who knows. The other thing you're going to get are legislative attacks and attempts. And that's been happening in a lot of different states that have been hitting PI in different ways, and some other kinds of litigation that have come about that's growing in the states. So it's always something I like to kind of teach and coach and educate on about as well. One of the things you might find a little distasteful is you get very disrespectful attorneys and some of their so-called lien expert staff, as well as from adjusters. They really put their nose down at a lot of those that are in PI, and they shouldn't, but they do. Part of it is merely an attempt to pay you less, but there is a lack of respect that even though you've earned and deserve it. And then, of course, you do get misuse and abuse, not only by some of those attorneys, but sometimes from even your own patients. When it's a difference between say your relationship and a little pot of money on the table, not always is your relationship going to prevail in the eyes of the patient who may have a real money need. So what happens, I've found, is that in PI, for the wrong reasons, fear grips and frustrations rise. It's just because you haven't been educated enough or guided along this path. But given I've given you the bad and the ugly, you're probably thinking to yourself, okay, Michael, so why PI? Why personal injury? And that's because there's so much better about the good and the great in personal injury. First is, it literally should be the highest paying segment of your practice, near full out-of-network rates. Now think about that. When you're dealing with in-network insurance, how low that is, you'll find oftentimes that one PI patient could amount to as many as, say, 4 or 5 of your insurance patients. And even cash is so much less than what you might do. So it really is awesome, especially the more that you can get paid. The next is cash flow. Cash flow is king. And while we talked about, yes, you must wait oftentimes, sometimes months or years to get paid, once you've established the PI side of your practice, you've got these checks coming in on top of your other business that you're doing in patients that are being seen. And that extra revenue is awesome. It's great when we had like the COVID interruptions or other business interruptions. You're moving, you're retiring. It's a beautiful thing. Another great aspect, which we'll actually hit this in a little bit of talk about BioWave later under a segment called profits, but you can bill for treatment that you deem as medically necessary, even though that insurance might say no. So that's really important that you get so much more leeway in the personal injury side. You just got to be able to support yourself that it is indeed medically necessary. You're also going to have higher practice valuations for potential mergers, exit strategies, whatever you're doing. And you think that dealing with attorneys is difficult. It's nothing compared with the paperwork headache that you got to deal with on the in-network health insurance side, or really out-of-network as well, and what they put you through. And I call it the resubmission game. Where you send in your bills, they claim after a number of weeks, sometimes a month, I didn't get it, can you send it again? And they repeat the cycle. It's very frustrating. One of the, I think, most important things from a patient health perspective is that in personal injury, you have improved plan compliance because these patients have a financial interest, right, in their treatment because of their case. And we all know that if a patient simply does what we tell them to do, there's a far more likelihood they're going to have an improved patient outcome. That means healthier patients. That means because of personal injury. Another thing that I think is incredibly valuable about the good and the great of PI is this built-in medical collaboration between medical specialties. People talk about growth through law firms. Well, I believe in growth through really patients and peers especially, and we're going to talk about that a little bit later. But here, because of all these medical specialists, these people that are on lien, You have the ability to not only educate them, but to get more referrals. And again, we'll talk about that a little bit more later. If you invest, maybe some of you invest in stocks. If you do, you might go from, say, Warren Buffett, where he will say, follow the money. Where is the money going? And if so, that's probably where you should invest your time and your business. Well, if we go back to healthcare reimbursements, which are just cramming down reimbursement rates, where is more money going? It's personal injury. Think of the states that have already increased the minimum bodily insurance coverage in their state. Arizona did it a couple of years ago. In New Jersey, I think it was last year. California, in January of 2025, doubles their minimum insurance rate. So the minimum patient, for example, walking in California is worth, instead of $15,000, $30,000. And that's happening across the country, whether it's already gone up or they're looking to plan to increase it. That's awesome. And while I talked about it taking time to be paid, there are fast pay options in personal injury too. And that comes under MedPay, or medical expense coverage, as well as PIP, if you're in a PIP state, personal injury protection. Those are basically auto policy benefits that are to be paid out promptly in exchange for prompt treatment. So that's a great thing in personal injury that you can take advantage of depending upon your state. Now, when we get back on growth, we obviously, what you want are new patients, right? A lot of people don't understand what you do, all your different practice segments. What you really need are more patients walking through the door. That is exactly what PI does. It is a great new entrance point for new patients to get exposed to pain management. Now, in personal injury, chiropractic, for the chiropractors out there, is the only industry where chiropractic is the lead medical specialty, #1 in the country. Nothing else. So why aren't you really having a significant PI side? And for the pain physicians, that is the other really important critical segment in PI, is when you're getting to the surgical side, especially pain MD evals, and all from orthopedists, neurologists, and you get also into the neuropsych and even psychologists with not just TBI, but PTSD. It's great stuff. Now, also, when you have that new patient, let's not forget, they're coming in under injury care. So whatever you have otherwise in your practice segment, now you can have this transition of those patients into your other segments or the specialties that you do. And again, that leads to more referrals. Another headache that you have with other patients, but not so much with PI, is you don't have the patient financials you have to get or patients you have to chase, because the attorneys have generally a statutory obligation to protect your interest. So you've seen the bad and the ugly, but the good and the great. And I hope that lets you see how wonderful this side is. So that's why I call it, in personal injury, the high profit highway, because it really is. What you've got to learn to do is to be able to access it and then to successfully navigate it. So to really do this the right way, like what I coach, teach, and train on is basically a 3-segment process. It's processes times profits times growth. It's having proven processes, because you're all into systems. You can't run a medical office or a medical business without having systems in place. That's how you're efficient and effective, you and your staff. It's no different in PI. There are just a lot of things that are unique to PI that can make you value drivers, right? And then profits, who doesn't like to get properly paid? I mean, that's why you're doing this. It's great because you're just devoted to healing people in pain. But I want you also more profitable. The last is growth, because you want profitable, sustained growth to scale. So let's hit really briefly, maybe 1, possibly 2 things in each of these segments, again, because we have limited time. So let's jump into the first one, processes. Like I said, these are the systems that make you efficient and effective. If I had to say what is the one thing that matters the most in personal injury, that most positions or protects you, it is the right lien or letter of protection. And again, you may be in an LOP state, Florida, Texas, Pennsylvania, others. You might be in a lien state, California, Arizona, others. Either way, they're all forms of liens, and these are contractual documents. LOP is more of a pseudo-contractual document, but there's ways to get your advantages there too. Now, I think that unfortunately, a lot of medical providers have not realized the importance of this document, not just the existence, but the wording. And why do I say that? Let me hit another movie. I'm a science fiction nut, so I'm going to take you to The Matrix. If you remember the first movie where Neo is down the hallway and the agents are in the hall and they're firing 1,000 different bullets at him, Neo stands up, puts his hand in front of him, and all the bullets stop. And then they fall to the ground. That's what a rock solid contractual agreement can do for your business. It's there to position you when it comes time to be paid and to protect you by the various provisions. Now, again, we don't have time to hit them all. Most liens literally suck. I see them all the time. I developed the first best one, most comprehensive in the country a decade ago, and it is being used around the country, but nothing has really been close, and it's disappointing to me because I would think that people would get better at that. But let me give you just 3 provisions you can put in right now that will advance your current lien. There's a lot more than that, but let's get you some value right now. So the first is make sure that your lien or the letter of protection that the attorney is sending to you, and you can send them the letter of protection you want signed, right, is that the patient owes the bill regardless of the outcome of the case. In most states, that is exactly the truth. So an attorney might drop a patient, they still owe your bill. They might get defensed at a trial, they still owe your full bill. So if they don't get enough in settlement, guess what? It's the same thing. That doesn't mean you don't negotiate, doesn't mean you maybe give them some breaks. I'm merely saying that's what the law generally holds. You know, there are some states where that's different. And it is going to matter, by the way, where you have some states where negligence, like say Florida, a comparative fault, if they're more than 50% at fault, there may be no recovery in the PI case. So you've got to have these things that are there to make sure that the patient understands they're still on the hook. The second is really important that the attorney has a fiduciary obligation to you, the provider. A fiduciary duty is the highest standard of care that the law imposes. Kind of think of like your bank and on your accounts in the bank. So the attorneys really have that to watch your back as well as their own client when they've received monies that you have an interest in. That's why it's so important that they sign your lien, that they issue that letter of protection. And by the way, even in the LOP states, one little tip, have every patient sign that extensive lien agreement, regardless of what the attorney signs. And the last provision I'm going to put for you here is, this is about comparing rates and then choosing you, right? So they basically are attesting that they've had a chance to compare rates, but they've chosen you and believe that your charges are reasonable because you know later on you get attacked. The last thing you'll note that I put there is that, especially for you, the pain physician side, let's say a surgical area, which is maybe going to be a much bigger bill, and you want them to attest that they're expecting in the PI case to receive enough, that's sufficient, to pay that full charge in good faith, right? So it really does matter, the right lien or letter of protection. So that's just one of so many things and processes to position and protect you. Let's get into profits. Hey, we all like to be profitable, right? So I'm going to talk about BioWave and negotiations Aikido. So BioWave is the first thing. You know, when I talked about how if something isn't billed or insurance is really pushing back on the entitlement, well, you've got some CPT codes for BioWave that will apply. And the PENS is a fantastic device because of the pain relief that it gives. And it's something which, again, you can bill, you can purchase and get at a lower rate and bill at a much higher rate. So it's a wonderful thing for being a profitable business. And obviously, BioWave is going to talk to you about it and educate you. I can only tell you it's a great thing for PI. Now, once you have something like that, is realize you're telling the patient's healthcare story. That's actually part of processes. And you can utilize how BioWave is helping to relieve that pain as you chart the patient's healthcare recovery using activities of daily living. And so when they're using the BioWave device or other methods and treatments that you're doing, it's allowing them to get closer and closer to the pre-injury status, right? Now let's shift out of that aspect of profit, which is great for your business, into one reality. Whether you like it or not, you're going to face them. The difficult attorney or law firm staff. You can't help it in personal injury. And that's where a method that I teach, which is about negotiations Aikido. It is learning how to out-negotiate personal injury attorneys. Now I say Aikido because Aikido is a form of martial art that uses the size, energy, tendencies of generally a much larger opponent against them, offensively and defensively, to where you have the advantage. And I do this in a way it's called applying the disruptive method of lien negotiation. And you see on the slide, each item, a letter disruptive, means something. So I want you to think of these as like a set of dominoes. When you align a set of dominoes up with twists, turns, up things, down things, as long as they're properly aligned, when you start them in motion, success is inevitable. And that's the way it is with negotiating with attorneys. Once you understand and learn how to apply this system, that's what that success means. So one of them I'll point out is like trust but verify. So you'll have attorneys that will assert to you law or facts, and you can trust what they say, but ask them to provide the support that you can verify what they're saying is true. And you'll be surprised how often they can't. A second one on there is just uncover the facts. That's the U. So important is that you got to dig and dig and dig for about the settlement recovery. How much was it? How they intended to disperse the intended settlement proceed disbursements. Because you'll find all kinds of ammo to help you get paid. Because in the end, look, you work so hard. What matters is not the gross monies you get in, but how much you net in your pocket at the end of the day. So why PI is so good, and it's worth the wait because the much higher profit that you can get, even when dealing with the attorneys. You just got to learn how. By the way, I'll encourage you to join and attend any of my Negotiation Aikido virtual online training workshops. One coming up late April, and we do them throughout the year. Highly encourage you and whoever's your key staffer to address that as well. So let's shift. We did processes, profits. Let's hit the last segment. So if you look at processes, it's kind of like, you're planning a trip and you're going to get going. You want to make sure you packed everything. When you got to go, don't want to say, oh, I forgot my wallet and have to go back. That's processes. Profits, you're on that windy part of the road. You've got maybe weather coming in. You've got a storm. You've got icy conditions, hazards you can see or not see. That's being profitably paid. When you get over the mountain and you're on that final stretch, the straightaway, the convertible top is down, you got the tunes playing, the pedal to the metal, that is growth. Because when you've done processes right, effective and efficient, and being properly paid, when you scale and grow, you are really able to rocket it. And my belief, listen, it's a way of showing how can you be a value driver to the good attorneys so that you become the go-to. And there's lots of things that unfortunately, a lot of medical offices do wrong that can torpedo a PI case, like having patients diagram accidents. Never do that. But there are things that you could do that make you so much more valuable to the attorneys that will help them battle the insurance adjuster. The real big bad wolf of PI is the insurance company, not the law firms. Okay. I believe in growing your business, though, especially through patients and peers. Patients know you best. And there's methods to utilize that, to identify raving fans, after you have created them, and to arm them, to shout about you. The thing I want to show you here today that I love about that I mentioned earlier is about medical collaboration. This is the beautiful thing for this area when you got this lean network. All these specialists that you see here in PI are all taking it on lean. So you've got this wonderful ability to further education about what you do, how you do it, your value add, growing your peer relationships that really can augment the partnerships you do, the referrals you get, the strategic alliances you create, and to help your patient. Because when you've got to get the right person as a specialist yourself, you got to make sure, by the way, that they do it on lean. And be careful about the ones the attorneys refer to you. It's great that they advise you to, but you're responsible to vet them. Because if you send to the wrong one, guess what? You're on the hook. That's your responsibility. And you've got to take this really seriously. So what we talked about again on this was that full formula, which is processes and profits and growth. And that's going to be how you navigate this high profit highway. And as we wrap it up, I want you to think about what's your goal for your business and where you're at. You might have never done PI. So it might be, hey, I got the knowledge. I want to get going. I want to be able to learn about this to even get started, right? You might already be doing this. Maybe it's a small percentage of your segment. So you're going to want some more strategies to do better. Maybe you do it a lot. Maybe you're a grizzled veteran. I promise you, there are so many new things that you don't know. And you just got to learn them to up you to another level. And that's some of these great tactics. And like anything else, if you can get the tools to make it easier for your staff, and I'm such a believer in improving and leveling up your staff, because that's what gives you the time to be focused on patient care. And they're like, again, back to BioWave, how BioWave allows, and just having one of your staffers utilizing that as you're treating more patients. But you get that back office staff and that person that is dealing with the law firms. Get them trained. What you want, and I think what any business should have, is a business advantage. And that's what we provide. In fact, that's what BioWave provides. These are business advantages. So Personal Injury Made Easy's Business Advantage program is something I hope that you will check out. It is a roadmap to successfully navigate this high profit highway. So learn about, get that more knowledge, get the more strategies, get the more tactics, get the more tools. And I encourage you not only to check out our website at personalinjurymadeeasy.com, but also look about attending one of the negotiations Aikido workshops. It's free to all of our Business Advantage members. I hope you become one. But even if not, and you've got that big accounts receivable, you're already waiting to be paid on a bunch of matters, you attend that negotiations Aikido course, you are making money the very next day. Thank you again, Brad and BioWave, for this opportunity to talk to your tribe and your important people, your clients and those that are looking at what you've offered, because what we want them to do is not just survive, we want them to thrive. You deserve it and you've earned it.
Michael, thank you very much for a great presentation on personal injury. So everyone stick around. We have a live Q&A session. If you have questions, you can put them in the Q&A box at the bottom of the screen. And I will read out the questions and we'll try and get all of the questions answered as best we can. So let's start. We actually have a couple questions. The first question is there an optimal number of BioWavePENS treatments that should be used on a personal injury patient? I could actually take that one, Michael, if you want. BioWave is great because it's a flexible treatment. We typically recommend 4 to 6 treatments, but if the funding pool or the patient's schedule only allows, for example, for 2 treatments, then that's still okay. It's still beneficial to the patient as well as to the clinic. Let's see. Next question. How does the clinic know how much money is in the funding pool? Is there a multiplier? Michael?
No, in the old days, God, when I was initially an insurance defense attorney, it actually was about 3 to 5 times the medical expenses that kind of were used by, say, the insurance adjuster in coming up what a settlement might be. And then that changed 20 years ago, right? To where they go more as low as maybe 1.5 times, sometimes even lower. So there's no magic formula on a PI case. In fact, I think one of the miscalculations that occurs is people thinking that a low impact case does not generate significant injuries. It's where kind of like when you guys are treating patients, I want you to not run away from pre-existing injuries. In fact, it's part of your job to pull that out from your patient who may be afraid to reveal it. But that can be the real gold, because it's the aggravation of that injury by the most recent accident, or personal injury, I should say, incident, that can get compensated. And it can really drive up the value. So because they're more susceptible from the prior, because of the prior injury, to getting injured now. So don't think of multiples. That's the attorney's job. I think what you want to make sure that you're doing, you're billing reasonably, get third-party support for what you charge and what you bill, because you may have to defend it at a deposition. Certainly, the more you can find that support and get it to the attorney, the more you're going to help the attorney defend it with the adjuster, who, trust me, they haven't found a bill they don't think should be reduced. Doesn't exist. So the more you can get to help them, you become more of a value driver.
Thanks, Michael, for your answer there. We have another question. It's kind of a follow-up to this question that you just answered. It's, how much does Dr. Coates see charged, billed per treatment, and how many treatments does he see ordered? Now, you're really an attorney, not a physician.
Well, now, I have a Juris Doctorate of Law. You can call me doctor. Okay, now, come on. But no, I'm an attorney by background, not but thank you there, because I think thank you for the honor of calling me doctor. Like I said, you'll have where there's, of course, your fees per code, and that's the most important thing that you look to justify. There's UCR books that help you calculate those things. There's some online sites like Fair Health Consumer is one to look for as you're looking for out-of-network rates. The other thing that yes, you do get attacked on or looked at is how much per visit. And that's, it's all over the place. There is no set amount. And of course, it's also going to range by geography and kind of what you do as your specialty. I think when you say per visit, maybe you're a rehab provider, a chiropractor, acupuncture, a physical therapist, that's seeing over time. If you're the pain physician side, you're really like maybe an evaluation or two, and then a surgical situation potentially, right? So again, I think it's just more that it's not so much how many visits, it's what's medically necessary, no more, no less. Here's the harder thing you sometimes have to do. Let's say you're a rehab provider. Let's say you're a chiropractor. Who wouldn't want massages for the next 2 years, right? You've got to cut off the patient sometimes because it's no longer medically necessary for that PI case, right? For that injury. So be very careful about being able to justify things as medically necessary, because that's getting looked at and scrutinized more and more, including by the insurance companies who are coming to attack doctors and how they're approaching not just PI, but all their patients where they're dealing with insurance or anything that the insurer might have to pay.
Okay, thanks. And per my answer to the first question, typically BioWavePENS is provide 4 to 6 treatments are what's provided to the patient, and that's typically what can be justified as being medically necessary. Next question. How important is a lawyer referral network? What is the provider's value proposition to the lawyer?
Great question. That's got a lot of different components. The first is refer to what I talked about there about actually patients and peers. I think that's more important in growing the segment of your practice. In fact, in some states, the relationship with law firms, let's say they're sending you a bunch of patients. In Florida, that's a bigger issue right now because of the 2023 Tort Reform Act. The defense can actually get into the relationship between you and the law firm. So if you have always cut your bills with the law firm, you never get paid in full, that actually can seek to maybe harm the case. So you actually have attorneys that are afraid to even issue letters of protection in Florida. So, in the end, what you want to present to law firms, I think, is, it's how are you different? Now, you say, oh my God, because I treat your patients amazingly. Well, that's great, but I think that, can you find me any provider that would not be sitting in the chair across from an attorney and say that same thing? So it's exhibiting your knowledge of personal injury. What are the things that help, even though you're a neutral party, okay, you don't have a position on the financial recovery of a case, but you can value drive in PI. Like what I said is when you can support your bills and fees and get into the attorney, that helps them to combat with the adjuster. Another thing is the opposite of a value driver is how you harm a case. That's why you don't diagram accidents. You don't play accident reconstructionist. You can literally kill a PI case because you have good intention, but you document things that creates a liability situation where maybe nothing existed. So there's a lot to being a value driver. It's part of what I do in the coaching program, laying things out. I just want you to think about, how am I different from my peers? How am I great for their clients? And how I'm someone who becomes easy to work with. And you should not think of easy to work with meaning I reduce my bills. You should think of billing reasonably and support that. And that's what you expect to be paid.
Thanks, Michael. Very good answer. Let's see. Next question. Can a PENS treatment be performed by a nurse practitioner without a doctor present? I can take that one. Because of telehealth, the doctor just needs to be accessible by phone, by Zoom. A chiropractor cannot put electrodes on and cannot bill. Some states may say yes, but we make a general statement that chiros should not be doing this. If a nurse practitioner bills for PENS under their NPI, they will get paid less. If a MA is putting the electrodes on, the doctor must be under the roof in the same clinic or building as where the PENS procedure is being performed. And by the way, this is the same for both PI as for workers' comp, where PENS is also used.
Well, in fact, if I might, you mentioned on telehealth, and I think a really important aspect of that in PI for all of you is gaps in treatment. So there's basically a national rule of thumb that if the patient waited 14 days from the date of the accident to first get treatment, the insurer may not pay anything from that point forward. And if during treatment they had a 14-day gap, they may cut it off at that point. So something really important is to identify not only gaps or potential gaps in treatment, but to be able to explain them. So many things that are missed, they aren't really gaps. The patient might have self-medicated. Home exercises, the home telehealth using the PENS device, right? Maybe they're on vacation and someone where they're on vacation can do the BioWave where they're at. Whatever that is, you want to be able to gather that document and show there was no gap in treatment. So telehealth is important. Again, it's something which can be not only billed, but support where a patient maybe has a problem driving to you in PI, getting to you, but they need to be able to progress on their treatment.
Very good point. Thank you. We have one more question. What are the contraindications for BioWavePENS? I can answer that. So BioWavePENS, you cannot insert the percutaneous electrodes over the heart or on the front or side of the neck, and they cannot be placed on top of the head. But you can treat directly over the spine, anywhere from the cervical spine at the base of the skull all the way down to the SI joint. The only other contraindications are that the skin must be intact. You can't place or insert a percutaneous electrode over a wound or over broken skin. And then patients who have implanted pacemakers are contraindicated, and patients who are prone to seizure, like, for example, epileptics, are also contraindicated. Otherwise, you literally can treat almost on any other location on the body. And if the patient has a pain pump, you can still use PENS. So it's very flexible in terms of what you can treat and what part of the body you can treat. So I hope that's helpful. Well, I want to thank you, Michael, for your time. It was a great presentation. Thank you, everyone, for your questions. And don't forget to look forward to our next webinar next month, and I'm sure we'll announce it in the next couple of weeks. So thank you, everybody, for your time.